The practice change I will be discussing today is the implementation of greater education on inhaler device technique for asthma sufferers. This includes initial and sustained education, as this will ensure the asthma sufferer's asthma and the asthma symptoms are managed to the greatest degree possible. I will delve deeper into this implementation later. However, I wish to briefly outline what asthma is and what the management strategies are to date. Asthma is an obstructive pulmonary disorder which results in chronic airway inflammation. There are various causes for asthma, ranging from allergic asthma, exercise-induced asthma, to even occupational asthma. These are all characterized by a history of respiratory symptoms, such as wheezing and shortness of breath. This occurs as a result of exposure to a trigger, the consequent release of inflammatory mediators, which then induces airway hyperresponsiveness, causing bronchoconstriction, subsequent airflow limitation, airway edema, and mucus hypersecretion. The aim of medications to assist with asthma is usually to improve ventilation and gas exchange. For asthma, these can be divided into two groups. First, we have the bronchodilators. These are the most commonly used as inhaled medications. These can then be subdivided into beta-2 agonists and muscarinic receptor antagonists. The beta-2 agonists, which include salbutamol and salmeterol, cause bronchodilation, whereas the muscarinic receptor antagonists, which include ipratropium and tiotropium, restrict the mechanism of bronchoconstriction, subsequently resulting in bronchodilation. The second group of medications used to manage asthma is corticosteroids. This includes medications such as budesonide, and the purpose of this is to inhibit the inflammatory response, thus increasing the diameter of the airway. The advantage of medications via inhalation is that it is delivered quickly to where it is needed. In this instance, it is the lungs, in a painless, convenient way with fewer systemic adverse effects. For the medication being administered to carry out its job, it must be inhaled, reach the site of action in the lungs, and then remain there until the desired pharmacological result is obtained. This is why education of inhaler technique is of great importance, because if this is not achieved, then the resulting relief and bronchodilation will not occur. The most commonly used inhaler device is the pressurized metered dose inhaler. However, there is a broad range of possible inhaler devices. Upon prescription, the prescriber will assist in the choice between all of these devices. However, various individuals have the preference of which they would prefer. The impacts of incorrect inhaler technique can lead to disastrous effects and far more severe asthma symptoms. When incorrect inhaler device technique is utilized, individuals who suffer from asthma put themselves at greater risk of experiencing severe asthma symptoms, whether this is a reduced response to treatment or poor asthma control. These subsequently lead to unstable asthma symptoms, significant morbidity, and premature death. Not only does this impact upon physical health, there are significant impacts on mental and emotional well-being, as there is a correlation between negative asthma symptoms and increased stress. But also the impacts of stress on asthma symptoms are significant, amplifying the importance of this education on inhaler technique to thus negate these issues. The mechanism that creates this shortness of breath in asthma sufferers is the combination of bronchoconstriction, airway inflammation, and mucus hypersecretion. However, focusing on this mechanism of bronchoconstriction, with the use of these bronchodilator medications via inhalation, this is alleviated. These medications are inhaled, travel down the trachea, reach the main bronchus, and branch off into the two lungs. This is where the effects take place. When inhaled correctly, these will ease this bronchoconstriction by either causing bronchodilation or inhibiting this bronchoconstriction response, ultimately leading to the desired effect of the airways opening and the asthma sufferer being able to inhale and exhale effectively. However, when inhaled incorrectly, these medications will travel down the trachea. However, they will not sit in the bronchus and relieve this effect. This incorrect technique inhibits these medications' effects, and there is a weakened sense of relief for the asthma sufferer. Over time, the misuse of these inhalers causes negative side effects, such as increased morbidity, and can eventually lead to an increased risk of mortality. The importance of this self-management of asthma change is highlighted through the various reports being produced constantly. There is a large population of asthma sufferers, approximately 80%, who perceive their inhaler technique as correct when this is not the case. This impacts upon not only their own health, but the perception of the effectiveness of these medications to assist with asthma symptoms. Education of inhaler technique is vitally important for asthma sufferers, as all of these adverse impacts of inadequate inhaler technique can be avoided. The idea of tailored education can be achieved through various means, ranging from prescriber demonstration to asthma sufferers actively seeking out the correct method of administration, particularly from reputable sources such as the National Asthma Council Australia, as these sources provide step-by-step instructions on how to adequately administer these medications. This also, however, raises the issue of continued inhaler technique, as long-term adequate technique can only be achieved through sustained education. Speaking on the importance of education also highlights how active education is far more informative than passive education, meaning activities such as prescriber intervention and education to show and demonstrate the correct technique is far greater than simply reading step-by-step instructions. This is not always possible, however, so ensuring that small steps are taken towards correct technique can assist in the minimization of this issue amongst asthma sufferers. An example of this tailored education, which can be easily accessed via reputable sites, such as the National Asthma Council Australia, is their step-by-step approach to administering medications via a pressurized meter-dose inhaler. Despite this information being only in textual format, it is far more likely to assist an individual with asthma to utilize proper technique, as opposed to mere assumption, as this guides inhaler device technique and will ultimately lead to improved asthma symptoms. As previously mentioned, there are a multitude of negative physiological impacts upon the asthma sufferer when incorrect inhaler technique is employed. Alongside these, there is an increased incidence of stress disorder, anxiety, and even depression through unmanaged asthma, whilst also contributing to this idea of a lack of control. Comorbidity between chronic physical conditions and affective anxiety disorders has been reported in large epidemiological surveys across the world. There is also a large focus of anxiety and depressive disorders having independent relationships with a wide range of chronic conditions. This includes asthma, and due to the nature of this disorder as it impacts upon one's ability to breathe, this further heightens this sense of anxiety and lack of control. There are a wide variety of barriers to the implementation of this practice change, including, but not limited to, the asthma sufferer's perception of correct inhaler technique when it is in fact incorrect, the asthma sufferer's level of motivation to change their practice and seek further education, the prescriber, upon administration, not providing adequate education, and healthcare workers such as nurses not monitoring or ensuring to provide additional education where possible. For this practice change to be impactful, all healthcare workers, including nurses, must ensure to educate the individual on the importance of asthma inhaler technique and how vitally important it is to review such things. By providing person-centered and non-judgmental care, asthma sufferers will feel a heightened sense of comfort and speak freely of their technique. The impacts of this education on the self-management of asthma are immense and lead to improvements in long-term management of asthma. As explored further in various studies, tailored education assists in the asthma sufferer's ability to take control of their condition and produce further positive physiological impacts. This is due to the subsequent decrease in the amount of inhaler device errors, leading to a decrease in episodes of acute asthma exacerbation. This leads to greater outcomes for all asthma sufferers and healthcare workers, healthcare provides ability to assist in this field to a greater degree.